my name is Marie Nikes Ugabinema, and I'm a public health and a clinical expert with over than 17 years experience in implementing WASH, TB, HIV, maternal child health, nutrition, equity and inclusion initiatives, programs and approach with international organizations, and I have collaborated mainly with government and UN agencies, and to name just few. So today I'm with 4 great presenters, and I'm humbled to be the moderator today. And without further ado, I want to introduce by saying that what if we dream a world without cancer? What if we dream a world where we not have to talk about delayed detection or care management, only because we have invested in what matters? Our session will be around the environmental factors, role in prevention and management of cancer, and we're gonna talk mainly about water, sanitation, hygiene, and nutrition. I'm sure that most of you have an idea that environmental factors are contributing a lot in occurrence of cancer, and again, contribute a lot in terms of care management. So today, I'm with 4 great speakers. We'll have a 15-minute presentation for each one of them. And if time allows, we'll be having a moderated session, Q&A session, and then we open for the audience. Shall we? Please, please. We are in world sector. We are not used to such kind of vibes. So try to show that you are with us, right? Yes. So without further ado, allow me to call our first presenter. Our first presenter today will be Mrs. Vestine Mukeshimana, who will tell us about the role of water, sanitation, hygiene as a care preventive measure, as a cancer preventive measure. Mukeshimana Vestine is the country director of Water Aid Rwanda since December 2022. Prior to this role, she served Water Aid Rwanda in the capacity of Head of Policy Research and Advocacy since January 2019, when she joined this organization. Since then, she played a considerable and strategic role in world sector policy, dialogue, and campaigns in various platforms and events fora, including participation in UN high-level political forum in 2019, Global Health Summit in 2021, in CHOGM in 2022, Women Deliver in 2023, Iowa Conference in Kigali 2023, to name few. Before joining WaterAid, Vestine, who is also an East African Community accredited hotel assessor, spent 11 years serving the government of Rwanda in its capital city of Kigali, in its all leadership arena, from tactical operation to strategic positions. Vestine holds 2 master's degrees, one in public health and tropical medicine from Southern Medical University of China, and another in development study from Kigali Independent University, a bachelor degree with honor in environmental health sciences from the University of Rwanda, and a postgraduate certificate of governance in urban sanitation from the United Nations Institute for Training and Research, rooting her versatility in development matters. Today, the title of her presentation will be Addressing Opportunistic Infection Among Cancer Patients, the Imperative of Water, Sanitation and Hygiene for Quality Care. Please join me to welcome Mrs. Vestine as she takes us through her presentation. Thank you.
Thank you very much. I would ask, okay. Thank you so much, moderator. Thanks, everyone. I won't delay much. My presentation is basically on water sanitation and hygiene alongside cancer management. Please move. I will stick on the nexus between infectious agents and cancer, which has been wrong recognized. Infectious disease, actually, you will all agree with us that they contribute significantly to the global burden of cancer. And from studies, it was shown that cancer patients become more susceptible to opportunistic diseases. When we look at WASH crisis, WHO report that approximately 1 in 4 healthcare facilities worldwide lack basic WASH services, while 1 in 5 lack access to sanitation services. WASH conditions, today, if we can all imagine, cancer complication and all its uncomfortability plus poor conditions of WASH, that's the equation everyone can be able to answer. Before moving ahead, I want to just give that narrative that every healthcare should have in mind that whatever the case, we are dealing with a human being who is still alive, who is emotionally sensitive, but also who is a social being. So, hold on, please. Please move. Move again. Yes. Addressing opportunistic infections among cancer patients would not only impact on the effectiveness of the quality or effectiveness of the healthcare, but also improve the well-being in so many aspects, from the psychological satisfactory to the comfort, but also to the cost of the healthcare itself. You can imagine if there is no water at the healthcare facility, any medication being taken by contaminated water would still not be as effective as it should. But also before that, if you look at the setup we are having today, minus water, sanitation, and hygiene, they are scaring themselves, putting that limitation to even adherence to service delivery of healthcare. Please move. When we look at the cause of opportunistic diseases, there are those infections that are caused by various pathogens, such as bacteria, fungi, and viruses, that poses significant challenges to patients' health and recovery. Among other opportunistic pathogens that commonly implicate